Anatomy of stomach. Anatomical position. A hollow muscular sac, present in the upper abdomen on the left side of the body. It lies primarily in the epigastric and umbilical regions. However, the position may vary from person to person and with the position and respiration. It is present between the esophagus and first part of the duodenum. Parts of stomach. There are four main parts of stomach: cardia, fundus, body, and pylorus. Cardia. It is the part of stomach which surrounds the cardiac orifice, which is the opening between the esophagus and stomach, which is guarded by cardiac sphincter. Fundus. A dome-shaped section at the top of the stomach. It stores gas which is produced during digestion. Body or corpus. It is the central large portion which is present below the fundus. It contracts to mix the food. Pylorus. It is the part of stomach which connects the stomach to the duodenum. It is divided into two parts: pyloric antrum and pyloric canal, and is guarded by pyloric sphincter. Layers coverings. From outward to inward, stomach consists of serosa, muscularis, submucosa, mucosa, serosa. It is the outermost layer of stomach. It consists of two layers: mesothelium, which is simple squamous epithelium, and thin layer of connective tissue. Mesothelium produces serous fluid. It is absent at the attachment site of greater and lesser omentum to the stomach and a small area where the stomach is attached to the diaphragm via gastrophrenic and gastropancreatic folds. Muscularis propria. It is the main muscle layer of stomach. It comprises of three layers of smooth muscles: longitudinal, oblique, circular. It also contains myenteric or Auerbach's plexus, which is responsible for movements of stomach. Submucosa. It is the layer of connective tissue that surrounds the mucosa. It contains blood vessels, lymph vessels, and nerves. It also contains Meissner's plexus, or submucosal plexus, which controls secretions, absorption movements of stomach. Mucosa. It is the innermost layer. It contains glands and specialized cells that secretes enzymes, hydrochloric acid, and mucus. The mucosa has ridges, rugae, when the stomach is empty. The ridges flatten out when the stomach is filled with food. This is the layer where stomach cancer arises. Borders and surfaces. The stomach has two borders: medial border, also known as lesser curvature, and lateral border, also known as greater curvature. Stomach has two surfaces: anterior surface, which is directed towards the anterior abdominal wall, and posterior surface, which is directed towards the posterior abdominal wall. Relations of stomach. Anteriorly, anterior abdominal wall, left costal margin, right lobe of liver, diaphragm. Posteriorly, pancreas, left kidney, left suprarenal gland, transverse colon, transverse mesocolon. Inferiorly, transverse, mesocolon. Superiorly, esophagus, diaphragm. Functions of stomach. Digestion, both chemical and mechanical. Absorption, hormone secretions. Blood supply of stomach. Arterial supply. The stomach receives majority of its blood supply from the celiac trunk, which arises from the descending aorta at the level of T12 vertebrae. The celiac trunk splits into three major divisions: the left gastric artery, splenic artery, hepatic artery. The left gastric artery runs along the lesser curvature and anastomosis with the right gastric artery, which is the branch of hepatic artery. The hepatic artery also give rise to the gastroduodenal artery, which later become the right gastroepiploic artery, which runs along the greater curvature and supplies the lateral stomach along with the two branches of splenic artery. The left gastroepiploic artery, and short gastric arteries. Venous drainage. The veins of stomach drains either directly or indirectly into the portal system. Left gastric vein runs to the left along with the lesser curvature. It receives the esophageal veins below the esophageal hiatus in the diaphragm and drains directly into the portal vein at the superior border of pancreas. Right gastric vein runs to the right along with the lesser curvature towards the pylorus. It joins the portal vein posterior to the first part of the duodenum. It also receives the prepyloric vein, which receives the veins from the first 2 centimeters of duodenum. The left gastroepiploic vein passes to the left along the greater curvature and with the short gastric veins drains into the splenic vein. The splenic vein is joined by tributaries from the pancreas as well as the inferior mesenteric vein and ultimately form the portal vein with the superior mesenteric vein. The right gastroepiploic vein runs towards the right to the head of the pancreas and joins the superior mesenteric vein and drains into the portal vein. Lymphatic drainage. Juxtacardial, gastric, short gastric, gastro-omental, and pyloric lymph nodes, drains into the celiac nodes, then intestinal lymphatic trunk, then cisterna chyli, then drains into the thoracic duct, which is the largest lymphatic vessel. Innervation. Parasympathetic through vagus nerve, cranial nerve 10. Sympathetic through celiac plexus. Thanks for watching.